So cardiac health is obviously very important. You got to make sure that you are watching yourself and taking your medicines, make sure your blood pressure is under control, your cholesterol is under control. If you're a diabetic, you want to make sure your diabetes is under control. All those are big risk factors for heart disease. Being that it's Heart Month, obviously, you want to make sure that if you need to see a cardiologist, that you do that. Also lifestyle, right? I mean, you have to implement a healthy lifestyle to a certain extent, whether it includes diet or exercise or both. Anybody's at risk for heart disease. It doesn't matter, whether you're Caucasian, African American, but certain types of people are obviously at a little bit more risk for heart disease, especially in the Southeast Asian community. Unfortunately, they have genetics that plague them with bad HDL, and so that HDL is a big risk factor for heart disease. And having a low HDL puts you at higher risk for heart disease than having even a high LDL.
The number one risk factor of heart disease is having a heart attack. So that's what we try to prevent. Heart attacks can happen at any time, any place. So the best way to prevent that is to control your diet and exercise as needed, and just be careful of what you do, how to take care of your body.
Anybody with any active heart symptoms, which includes chest pain, if you're having progressive shortness of breath, palpitations, passing out, anybody with something that could be related to heart disease should report to the emergency room. There's been several advancements, right? Like now we don't have to necessarily do open heart surgery to replace your aortic valve. We can do that through the groin. There's been advancements in heart failure treatment, for example, to reduce hospitalizations, like a sensor that you can implant to kind of monitor people's fluid levels. So if somebody has heart failure, by the time they actually get to the hospital and have to be admitted, this has been going on for several weeks that they've been retaining all this fluid. So we have ways of trying to prevent them from keeping in the hospital. Obviously, there's advanced heart failure therapy at the medical center, which includes, LVAD, which is a left ventricular assist device. It's kind of like a pump that pumps for your heart, or even transplant if you're indicated for it. So I like to tell people, I like to think of your heart kind of like a house. It has architecture, plumbing, and electricity, right? And so if you're talking about heart problems, you're talking about either a problem in one of those three things. So either the architecture of your heart, the valves, the function, either the plumbing, so the blood vessels that supply blood to the heart, or the electricity that is what helps the heart beat. And so you either have a problem with one of those, or you could have a problem with all three of those. And so they're all kind of codependent.
It is best to take care of it early. It is best to recognize it and get help. Any question you have, any concern, it is best to bring it out in the front and let your doctor aware that you may have condition that need to be addressed. It's always best to do it early as possible.